So static cupping, that's the standard cupping that you probably would have seen, where you're popping a cup on and you're leaving it for a length of time. Flash cupping we're going to do first. You can see there's a few marks there that might not have been so apparent earlier on because there was the general erythema that was hiding them. That just means we can go over that area again, but we're going to try to avoid it. And we're just going to keep an extra eye on that just to make sure we don't get excessive speckling, excessive erythema. Flash cupping then is something, to be honest, I rarely use. When somebody marks like really, really quickly, then I probably should not use cupping on them. There's usually a correlation between how quickly they mark and how unpleasant they find it. But I'll show you what flash cupping is, because that's an option you can use, which is, it's not dynamic, it's static, but the cup's not going to be on there anywhere near as long as it would be with static. Because you think with static cupping, I'm starting here, I'm applying all these cups all the way to here. By the time you've done that, this one's been on for twice as long as this one has. So flash cupping avoids that. That's nice and close. We're going to have 3 cups for this. So we can do this anywhere really, and the reason I'm doing this in certain lines is so that we can use the other bits later on. So you can do it over the spinous processes, no problem at all. We're going to target the erectors. So the erector spinae coming all the way up and all the way back down. We'll start with flash cupping, which is 1 cup just to the side of the spine. Let's go for 2 pumps because we're not moving this over the skin now. 2 is usually a good place to start. 3 might be okay. We'll just go with 2. Leaving a thumb's width, depending on the size of your thumbs, or quite big ones, in between cups. Pop in another cup on, just like that. So we can go with a 3rd cup. If somebody marks really quickly, you might find that they're already starting to go bright red in this one. So if that's the case, flash cupping might be the option, which is release the pressure and add that one to the start. So we're leapfrogging, making sure we don't leave 1 cup on too long. You can see that fascia being pulled into a stretch, especially by the way that it releases. And take it off. All the way to the top. And now we're going to swap to the side. Interesting now that you can see there's one there that's marked particularly red. It's a strange phenomenon. It's certain areas of the body. We'll look into theories as to why that is a bit later on. Does it mean you've got good blood supply? Does it mean it's quite tight? What does it mean? There's no concrete answer, but we'll look into some theories later.
How long, with someone that marks, is that likely to stay? Yeah.
It varies. I usually say between 5 and 7 days. So it can be quite a while. It can look quite brutal. It can look like, you know, when a bruise starts to go a bit purpley brown, a bit yellow as it fades, it can look like that. It is capillary dilation, which is why it's so important to remember that it's incidental to what it is you're trying to achieve. I'm not trying to give you red marks. I prefer it if it didn't, but it happens. So a bit of a difference there in markings. We can look into why that might be later on. That's flash cupping. I think for the frequency that you'll use it, it's not worth spending too much more time on that, just to understand that it's out there. So when you go and practice this demo, you can practice flash cupping before you then begin, and just have a look and see how quickly they mark, which you'll probably be familiar with by now. Static cupping, we can do this in all sorts of different pretty patterns across the back, but we're going to do it again focused on the erectors, mainly because later on we're going to do it on the spinous processes for different purposes. So you can do it spinous processes, you can do spinous processes and erectors. I would always just make sure, the general rule is that you're going to leave a thumb's width in between any cups. We don't want them touching, that's going to give a pinch. So let's find the spine. It's quite waxy. PSIS somewhere around there. You can go on top of the PSIS if you want, whatever floats your boat, but we're going to do some work on that later, so we'll leave it blank for now. 1 cup, and now we need to move quite hastily. And I'm going to go to the right side, and now work our way up. And the reason I'm going quite quickly is because I don't want to have to think about removing certain cups a great deal of time before the rest of them. Let me know if that starts to feel a bit pinchy or unpleasant at all. If they do report a pinch, that's quite normal. As long as the cups aren't touching, that's fine. It's just the fascia, it's the stretch on the skin. That should start to ease. So I usually say, okay, that's normal, and then check back in with them in a minute or two, and usually, to their surprise, the feeling's gone, and then they'll feel okay. It could be desensitization of the tissues, it could be the fascia stretching and allowing that to happen. either way, it's what we're looking for. So there we go. So we've got the static cups on there now. You can have a little look, and I would say it's quite uniform marking there. Everything's a nice even colour, which again later on we'll look at what that might tell you. Have a look for uniformity within the cup as well. We're looking for that sphere. You might sometimes see a little dimple in the middle, or a bit of a dimple off to the side. Usually just a restriction in the fascia. That can be pulled out over time, and you often see that. What I'm looking at now though is the colour. Just making sure that we don't go past anything that would be an unacceptable colour.
This one is quite dark.
That's quite dark, yeah. I think there's a difference between dark and angry, and that's borderline, I would say. So we'll keep an eye on that one, and these top ones. Lower ones we're looking okay. And if they do start to look particularly dark, call me over, I'll let you know. I mean, you need to kind of see it to know, but you've all picked up on that, which is great anyway. And then if you need, you just remove it.
Yeah.
Keep an eye on the rest. Apart from that, how long do we leave the cups on for? It depends, really. Depends how much pressure's in the cup. Depends on how the patient's feeling. If there are any pains, does that feel okay, Andy?
It feels slightly pinchy on, I'd say all of them, actually.
Okay.
I wouldn't say it's a comfortable feel. A bit like a little bit of burning.
Right, okay. It's, I think, like a Chinese burn.
Yeah.
That sort of, yeah.
Yeah.
It's just, that's usually the stretch on the fascia. I would take that on board and then come back in a minute or so and ask, has it decreased? If it hasn't, the options are we could take the cups off, put one pump in instead of two, or just remove the cups altogether because maybe they're not helping the situation. That one now, it's time to come off, I think. That's not too bad. That will fade quite nicely, I think. And then keep an eye on the rest.
So
It just,
roughly how long you keep them on? I know you just said it's dependent.
yeah, it's so difficult to know. I think as long as I can get away with it, basically, because that fascia is going to respond to the slow stretch. And you can see that on the lines in between, you can feel it as well. It's obviously the skin that you can feel there, but it's going to be the fascia underneath as well. On average, about to give you a time interval of about 10 minutes. Yeah,
Gosh.
yeah, it's fine. I think we won't do that in here because then it really eats into the rest of the time we've got to do these techniques. So let's take them off. So taking them off, actually I should go in the order that I put them on, but these have marked a little bit more,
Yeah,
so maybe both.
Would you do that if it's, say, getting angrier? You know, just pick those ones up first.
Yeah, I think so. And you might have some down here that are not marking at all
Yeah.
compared to these that are, I would say, quite healthy colour, quite an average colour,
Yeah.
not anything to worry about. Which shoulder was your bad shoulder, by the way?
This one.
Interesting. Yeah, so you can see the darker two marks there. Again, it's not going to conclusively diagnose anything, it's just an interesting observation.
Yeah, the lumbar ones are quite pale, aren't they, compared to...
Yeah, that's quite
Love
typical.
it.
It's quite typical that you'll remove these a good 5 minutes before you remove these.
Yeah.
So there, yeah, we've got a bit less, and it could tell you a few different things. Just finish off with a bit of effleurage as well, just lightly over the area. To just move fluids through, and just let them know that they're okay. Good hands.
Fine. Okay.
Right, so we'll go away and practice that. I want you to do flash cupping, using 3 cups, and then static cupping up the erectors, and we'll see what you find.